Hello, I'm Greg Jamian, and thank you for watching Boomer Health at Home, the show where we explore the most relevant healthcare topics impacting the baby boomer generation today. As more and more baby boomers seek answers to many times difficult healthcare questions, our goal is to provide ideas, tips, and cutting-edge solutions that will help improve your everyday life and health. It is our hope that you find the following information helpful as you sit back and watch Boomer Health at Home.
Hello and welcome to Boomer Health. I'm Maggie and Megan, Director of Nursing at AmeriStaff Home Nursing Services. Today we have Megan Gervin, Nurse Clinical Supervisor at AmeriStaff Nursing Services. Hello Megan, how are you?
Hello Maggie, I'm fantastic.
Great. Today we're going to be talking about the respiratory system and problems that can arise within that system. What are some major parts of the respiratory system?
So when people start thinking about the respiratory system, usually they're thinking about their lungs. They're not thinking about all the other components of it. Okay. So you really have to start at the top. There's all these hollow spaces in the bones of your head that are called sinuses. Usually people start to think of that when they get a nice sinus infection. Mm-hmm. But those sinuses are actually there for a reason. They help add humidity and actually regulate the temperature of the air that's coming down into your system. When you get down to actually what's breathing in oxygen, people usually know that one, your nose and your mouth. The nose, actually, the hairs are there for a reason. They're not just there to be clipped out with a beautiful nose hair trimmer that, you know, your daughter got you on Christmas. It's there to actually help filter out some of the germs, the bacteria that's in the air.
Okay.
Air then moves from the mouth nose down your trachea or windpipe, some people know it as, moves down into bronchioles that split off into two, and then you get down to your lungs. When you get down to your lungs, that start to look like, if you think of a thing of grapes. There's a bunch of different little sacs that are down there, mm-hmm. and those are actually what does your air exchange down in the lungs. On the right side, there's 3 lobes, and on the left side, there's actually 2 lobes in your lungs.
Okay. So how does aging change your lungs?
So everyone's lungs mature at around 20 to 25 years old. They do start to decline when you hit 35 years old, so we're already starting to decline.
Oh, wow.
It's not fun.
Okay.
They usually hold 6 liters to start with, so if you think about your 2-liter bottles, it's a pretty large volume of air, but it will start declining when you start hitting 35. So.
Okay, so what does that decline look like for me then?
So your diaphragm will actually start to weaken. Your lung tissue will become less elastic. It becomes a little more hardened. Okay. And actually your rib bones will start to shrink a little bit, and then you won't get that expansion and be able to take a deep breath in. They don't move out as well. Okay.
And then what things in someone's history can cause this type of lung damage?
So smoking is one that people usually know about. Mm-hmm. A lot of people we have come in that actually they had to be around secondhand smoke back in the day. There wasn't all these areas that, you know, is non-smoking, especially like flight attendants, anything like that, to where you could smoke on a plane, you could smoke anywhere you wanted. So they were exposed to these secondhand smoke. The other thing is these genetic conditions that you really have no control over. It's just part of your genetic makeup. And then there is different things back in the day in factories, different chemicals. I grew up in a farm town, so farming, they used to spray without masks on, so they actually have a thing called farmer's lung where it's damaged from the chemicals of spraying.
Wow. Up until about, I'd say 10 years ago, I remember being at a restaurant in the smoking section, which was right next to the non-smoking section. Mm-hmm. So there's a lot of secondhand smoke that's going around that we didn't even know about probably at that time, right?
Yes, yes.
Okay. So lately I've been hearing a lot about COPD when we talk about respiratory issues. You see a lot of ads for certain types of inhalers for COPD. What is COPD?
So COPD is actually an umbrella term. People usually know the terms emphysema, asthma, bronchitis, but they don't exactly know that that's COPD. So COPD they just made as a big old umbrella term for difficulty in breathing, pretty much. So it kind of encompasses all of those.
Okay, so what does COPD look like in the lungs?
So COPD, there's a couple different things it'll do. There's inflammation all down your airways that makes things swell up, makes it really hard to breathe. The other thing it can do is that bronchitis, but instead of it just being a little illness, it doesn't go away. It's a long-term chronic bronchitis. So you get in those branches off, you get swelling, you get this thick, heavy mucus that you have to keep coughing and trying to clear. And actually it'll start to change the lining a little bit too and make it a little bit harder and, you know, not quite as beautiful as it used to be.
Okay.
Now down in the lungs, those grapes we talked about earlier, that there's a bunch of little ones around, they will actually burst, become these larger air sacs, so you don't get great air exchange, you don't have all this great surface area.
Okay.
So, and there are different stages of COPD, so a lot of people, when they're starting out mild COPD, they usually don't even know they have it. They just have an increased cough and some mucus and sputum. When you start to hit the moderate level is where we start getting a lot of problems. You get, you know, your first real episode and you end up at a doctor's office. You might end up with like one inhaler, that type of stuff. They'll start doing, you know, different testing for you. Mm-hmm. Then when you hit moderate is when, or severe is when you really start to feel pretty bad. They'll give you some combo inhalers, maybe some steroids. Then when you hit severe, or from severe to the end stage COPD, that's when you're being hospitalized quite a bit. Okay. You're calling 911. It's a pretty severe reaction. Okay. And that is just as it says, it's the end
stage of
your
things.
Life usually, yes.
Okay, so if my doctor thinks I have COPD, or if I feel like this cough just isn't going away and I seek attention, what are some of the tests that would be ran to kind of verify, is this COPD or do I just have a cold?
Yes, so there's a couple different things that they do. They can do pulmonary function tests. If they think you have any respiratory illness, you'll end up doing these. Some people have already had to, I've had to in the past. And it's a couple different ways they can do it, but the main way they do it is pretty much blowing into a straw. And they'll tell you to blow these leaves off this tree, like on this picture. And it pretty much just measures your lung capacity and, you know, different things on your breathing. There's a whole different scale and waveforms and stuff they're looking at. You don't have to worry about anything like that. Okay. But it kind of scores you and puts you on the spectrum. Okay. A lot of times they'll do a chest x-ray or a CAT scan, which sometimes we find it accidentally because you came into the hospital or the doctor's office for something else. And then we found it on that. So you may have some follow-up tests that way. Okay. The other thing that they can do, instead of drawing blood from a vein, they can draw it from an artery. It's usually in the wrist. They'll poke in. Those blood tests will actually tell a lot of different things about your blood. It'll tell you what the pH of your blood is, how much oxygen's in there, a lot of different chemical levels, and then how much carbon dioxide is in your blood.
Oh, okay, carbon dioxide levels. I've heard of this recently. So if someone can't get rid of their carbon dioxide levels, sometimes they can be on a ventilator. This just happened to one of my family members. What can you tell me about this?
So this happens quite a bit, unfortunately. When I used to work in an ICU setting, we had people on ventilators for this a lot. Okay. It comes from different sources. It pretty much is that you can't rid yourself of the waste of carbon dioxide. Okay. So it starts to build up in your system. There's a fancy word for it, hypercapnia, which apparently I'm going to stumble over right now.
Easy for you to say.
I know, right? So it gets stuck in your body. So pretty much you're bringing, you know, some oxygen, but you can't get the carbon dioxide out. Lots of different reasons this could happen. You could have sleep apnea where you stop breathing in your sleep, changes in your breathing pattern, you know, could be from meds because you're obese, something along those lines. There's some genetic or kidney problems that can cause, you know, you to accumulate as well. The reason that you have to go on either a BiPAP or a ventilator is that you need some extra help. You need some help with some pressure going in and some pressure coming out to keep those airways open, and it allows that exchange to happen.
Okay, great. So with this wonderful snow that we've been getting in November, it reminds me of, flu season, cold season, all these bugs and infections are going to be coming about. So what are some of the infections that can come within the respiratory system?
So you can get an infection anywhere along the line in your respiratory system.
Okay.
Most people have had a sinus infection or bronchitis. Unless it lasts more than 10 days or you're having some pretty severe symptoms like a temp over 100.4, you're starting to turn yellow-green, nastiness coming out. You usually don't have to go to the doctor. It'll resolve in 10 days. If it is turning into those things, then you should go to the doctor. They can help you out. But if it's not bacterial, if they don't think it's a bacterial infection, they really can't help you out too much. They can't give you antibiotics if it's not going to help. So there are a lot of over-the-counter nasal sprays, those neti pots, that type of stuff that can help clear stuff out. As you're getting lower, though, and you get down into those lungs, you can get pneumonia. And pneumonia can be caused by viruses, funguses, and then bacteria. So depending on what's going around is what you can pick up in the respiratory system.
Okay, so there's a lot of different things that can cause pneumonia.
There are. It's not just bacteria.
All right, so what are some of the major ones you see out in the field, in a healthcare setting, or in a hospital?
So bacterial-wise, there's different ones depending on where you're coming from. So out in the community, you'll hear different things of, I went to the hospital and they said I had a community-acquired pneumonia, or I was in the hospital and I ended up with a hospital healthcare-acquired pneumonia. So those do differ slightly because of the bacteria that's out and around in the community versus what's in the hospital and healthcare settings, say in a nursing home or hospital dialysis centers, stuff like that.
Okay.
So unfortunately in hospitals we are exposed to bacteria a little bit more, and they tend to be resistant strands because they've been around the antibiotics and they decided to mutate. The ones out in the community can be a little bit, I won't say easier to treat because some people don't do well still. But it tends to be something a little bit lighter, like a strep pneumonia. There's a lot of different bacterias. Then there's also viruses and funguses. So you could get the flu, the RSV, it's not just for kiddos and little babies, and end up in the hospital with pneumonia from those type of things as well.
Okay, so there are certain treatments for certain strands of this pneumonia then?
There are.
And then figuring it out while you're either in the hospital or with your physician, is that correct?
Yes.
Okay.
They could take a sputum sample, run it, and then find out what it is that's growing in your sputum.
Okay. So as healthcare moves forward and we try to be more proactive instead of reactive, what are some ways to prevent pneumonia?
So just taking care of yourself is one of the biggest things. Be healthy.
Okay.
Now during this beautiful flu season and all the other germs that are flying around in the air, trying to stay out of large crowds is a good idea. I know Christmas shopping's coming up, but that's kind of why Amazon Prime and all these other great online shopping things came about. You can have it right shipped to your door, and you can be nice and lazy and sit on your couch while you're doing it. Those are some of the biggest things you can do. Washing your hands, just being proactive, wiping stuff down, using your Lysol and bleach products.
Okay, great. Why is it that some people end up in the hospital with pneumonia and some can be at home with their pneumonia?
So depending on your immune system, is kind of where that lands you.
Okay.
So if you have a weakened immune system, or you maybe were just sick with something else and your immune system's already down, you could end up having to go to the hospital. So just depending on how healthy you are is kind of where you end up.
So again, with it being cold and flu season, as a healthcare provider, I feel that a lot of people come up to me and say, I think I have the flu. No, it's just a cold. What is the difference, and how do we really kind of gear our population to kind of seek the right healthcare at that point versus, cold, flu? How do you know?
So a lot of people will say, I have the flu, or I have the stomach flu, or I think the term has just been used very loosely for a very long time. Some people use it interchangeably with a cold. The symptoms are very similar, so it's easy to mess that up. And it's just the terminology that's been around. So the actual flu is a respiratory virus. It is not a stomach bug. If you have the stomach bugs going on without respiratory symptoms, you don't have the flu. You
Okay.
just picked up something nasty or ended up, getting some food poisoning, so which is never fun either. With the cold, again, very similar to the flu symptoms. You get, the sneezing, the coughing, the high fevers, body aches, chills, headache, all that fun stuff. But they have these wonderful things at your doctor's office in urgent care. It's swabs. They just stick it up your nose. They're not terribly comfortable to have done, but they're very fast. They can actually send those off and tell you if you have the flu or not. And how that helps is that they can run a flu panel. That one's pretty quick. They call it a rapid test.
Okay.
So if you have the flu, they can come back and give you this beautiful antiviral drug called Tamiflu if you came in within 2 days. And it actually decreases your symptoms, decreases the length of it. And then they can actually test you for a respiratory virus panel. And that one, it's a mile-long list, and it will tell you which respiratory virus you have. Now, based off of if you have this virus, they might not be able to give you a prescription medication for it, but they can give you some supportive care. Maybe, you're having trouble breathing, they could give you a breathing treatment or something along that line.
Okay.
So
if your flu-like symptoms or your cold is concerning for you, going to an urgent care or your regular physician is the way to go, correct?
Yes.
Okay, good to know. So a lot of patients take over-the-counter medications. You hear, the Theraflu, Sudafed, Robitussin for a cough, and things like that. Can everyone safely take these over-the-counter medications?
Unfortunately, no. Because if you have anything with your heart or blood pressure issues, you really should consult your doctor. A lot of the over-the-counter meds have decongestant properties to them, and how those work, the side effects of it can raise up your blood pressure and your heart rate. So the best thing you can do is actually go to your doctor, find out which over-the-counter. There are some over-the-counter products that are safe for blood pressure, but your doctor can kind of guide you on those, and you need to go get your nose swabbed anyways to find out what you have, so then your doctor can tell you what to take.
Okay, so I've heard you mention antiviral medications. What's the difference between an antiviral and an antibiotic?
So depending on what you have, if you have a virus, they will give you an antiviral medication. It fights viruses. If you have a bacterial infection, they give you an antibiotic. Same with like a fungus. If you have a fungus, it's an antifungal. So if you have a virus, they can't give you an antibiotic because it's not going to do anything. The only time, if you say have the flu, but then they think another like bug kind of snuck in and set up shop while your immune system was down and caused a bacterial infection, then they might give you an antibiotic. But just going to the doctor and expecting an antibiotic all the time, you're going to be a little disappointed because they're probably going to send you home without an antibiotic.
Okay.
So.
All right. What are some of the other small things that can be expected this winter within the respiratory system?
So one thing that actually recently came up with my grandparents is that they get nosebleeds. It's dry out, and actually my grandpa just spent time in a hospital, which is extremely dry inside of a hospital. So there's different things that you can do, keeping the humidity up in your house, using humidifiers, using saline nasal spray. And the other thing that happened is my grandpa's on a blood thinner. So he actually ended up, it looked like a massacre, and it lasted for 2 hours because they're more likely to bleed all over the place, and that it's very traumatic. So there's different things that can help with that as well. You can do an Afrin nasal spray that'll actually help stop the bleeding, or do some ice or compression.
Okay.
If it keeps bleeding, you do have to go seek emergency help because you might need a little bit help, stabbing that off. So an ENT doctor can help with that.
Okay, wonderful. Thank you. All right. Well, that concludes our show today for Boomer Health. Megan, thank you so much for attending.
You're welcome.
We really appreciate everything. If you guys have any other questions, please feel free to reach out to me at AmeriCare at 248-288-2270.